Great. So let's now run through assessment findings for celiac disease. Number 1, there is steatorrhea. Do not let the term scare you. Steatorrhea means that stools that are frothy, stools that are pale, bulky, foul-smelling, and greasy. So for celiac disease, they come up with these stools. There's steatorrhea, which is the number 1 symptom for celiac disease. Number 2, chronic diarrhea. And then failure to thrive. If it starts right from infancy, as I described earlier, there is issue with absorption. So that child will surely have poor growth and weight gain. Number 4, grossly distended abdomen. Some can present with an enlarged abdomen and would have muscle wasting in the muscles of the limbs and in the buttocks. They can come up with abdominal pain, irritability, vomiting. These are all common symptoms associated with celiac disease. So it's very important that you know the stool characteristics. So that is why I would want to go over again the stool characteristics for celiac disease. You can be tested on that. And you shouldn't forget this because I'm stressing on it. Steatorrhea, the stools are pale, bulky, frothy, foul-smelling, greasy, and then they would have loose stools. So take note so that anytime you see these options in a multiple choice question, you will be able to pick the right answer. So some diagnostic tests can be done. Mostly we will do the jejunal or duodenal biopsies, and this helps to show the atrophy, the changes that are going on in the intestine. So jejunal and duodenal biopsy will be the diagnostic test for celiac disease. And sometimes other conditions can mimic it, so we can do pancreatic enzymes and then the sweat chloride test in case we are also suspecting cystic fibrosis. So we do this test to rule out cystic fibrosis. It is not the test for celiac disease. So the main test is the biopsy, intestinal biopsy, jejunal and duodenal biopsy, which will show the characteristic atrophy of the intestinal mucosa, which has been caused by the damage by the gluten. So let's look at complications. It's important that you know some complications of celiac disease. They include anemia in the long term, malnutrition because the client is not absorbing the nutrients from the diet that they take, and with time there can be softening of the bones, which is called osteomalacia. And some rare complications with time, it puts the client at risk of lymphoma, non-Hodgkin's lymphoma. So take note of these complications. So as we rightly said from the beginning, celiac disease is an autoimmune disorder, and sometimes it will come with some associated medical conditions. And some of these associated medical conditions include type 1 diabetes, thyroid disorders, Addison's disease, and then liver disease. So take note of some associated medical disorders for celiac disease: type 1 diabetes, thyroid disease, Addison's, and celiac and liver disease.